You just had a colonoscopy and your doctor mentioned finding a polyp. It is natural to wonder what that means for your health. What kind was it? And are all polyps the same? When we talk about polyps in the colon, two types often come up: hyperplastic polyps and sessile serrated polyps. Yes, they are indeed different, and understanding these differences is incredibly important for your colon health and for guiding future care. Hyperplastic polyps are generally considered benign. They are very common and typically found in the lower part of the colon, such as the rectum or sigmoid colon. They grow slowly and rarely, if ever, turn into cancer. Think of them as usually harmless bumps. On the other hand, sessile serrated polyps, or SSPS, are more concerning. They often appear flat or slightly raised, blending in with the colon lining, and are more frequently found in the right side of the colon. Their distinct appearance under a microscope, which looks like a sawtoothed or serrated pattern, is what gives them their name. Crucially, SSPS have a higher potential to progress to colorectal cancer over time, following a pathway that is different from other common types of polyps. So, what does this mean for you if one of these polyps is found? First, any polyp discovered during a colonoscopy will be removed and sent to a pathologist for microscopic examination. The pathologist will determine the exact type of polyp and whether it has any concerning features. If it is identified as a sessile serrated polyp, your doctor will likely recommend a more frequent surveillance schedule for future colonoscopies. This is because of their increased risk and their subtle appearance that can make them harder to detect initially. Knowing the specific type helps your doctor tailor your follow-up plan, ensuring you receive the most appropriate care to keep your colon healthy. It is important to know that sessile serrated polyps are considered precancerous lesions. This means they have the potential to develop what is called dysplasia, which are abnormal cells that can eventually become cancerous if not removed. Hyperplastic polyps, in contrast, very rarely show this dysplasia. The subtle and flat nature of SSPS also means they requiring a very thorough and skilled examination during a colonoscopy. They can be tricky to spot, emphasizing the expertise needed during your screening procedure. Ultimately, while both hyperplastic and sessile serrated polyps are growths in the colon, their underlying biology and potential to progress to cancer are distinctly different. Hyperplastic polyps are generally low risk, but sessile serrated polyps carry a higher, albeit still manageable, risk of becoming cancerous. Regular colon screenings, meticulous removal of any detected polyps, and following your doctor's recommended surveillance plan are all essential steps to protect your health and prevent colon cancer.